You just flee from a different situation to another situation.
Yeah.
So if you're dating, you may go from one person to another person and everything, but it may be you. So you may have to change some things within you. So like me, I'm constantly working on boundaries.
My dental friends, Kari Carter-Cherelus. She's a registered dental hygienist who has turned her career into motivational speaking to benefit dental hygienists and their teams, dentists and their teams. She is now an author of an incredible book. She's a speaker and a consultant for teams to help them redefine what happiness is in their practices and how to help teams be teams, and specifically guiding individuals on how to avoid burnout. And even, as she mentions in this episode, recover from burnout. You know, this episode was fascinating to me as a dentist and a team leader, as a business owner, to hear the perspective from the hygienist's perspective, and especially during these times where really we are struggling with a lot of attrition, a lot of people looking for a different place to work, trying to understand how to best support our team members. Also in this episode, you'll hear why Kari hates it when dental offices refer to their team members as family. Fascinating. So join me in this really interesting perspective from Kari Carter-Cherelus. Hello and welcome to the Business of Happiness podcast. I'm your host, Dr. Tarryn MacCarthy, and we have today with us a very exciting guest, also from the dental world, Kari Carter-Cherelus. Did I say your name right, Kari?
Basically, Kari Carter-Cherelus. It's fine.
Cherelus. I love your name. It's beautiful. Kari is a consultant, speaker, author of the book titled The Ultimate Guide for Dental Hygienist Burnout. And she is a self-proclaimed healer of toxic workspaces. So this is so proponent to what we are dealing with in our world, in the dental world at the moment, and in most businesses at large right now, wouldn't you say?
Exactly. Everyone is suffering from burnout. I get tons of articles sent to me daily due to my guest Google algorithm. So they're sending me everything, and you see it on the news. So everyone's really dealing with this, especially because of the pandemic, and then also the great job resignation. So yeah.
Absolutely. You see it everywhere. These signs that say, we're understaffed, please be kind. We're trying our very best right now. And so I think everyone's just feeling overworked and overwhelmed.
Exactly. It's a big problem that a lot of people are having, especially because it's my field, my industry, the dental field especially. There's a great shortage of dental hygienists, of all dental professionals. So if you go on the dentist forums, the dentists, they're complaining they can't get anyone. If you go on the hygienist forums, and the hygienists are complaining that, it's because of the toxic work environment that they don't want to go back to work. It's not the extra little baby money the government's was giving anyone. So yeah.
Yeah, absolutely. So what is the biggest problem that you're finding from the people who are speaking to you in terms of what is causing this quote unquote toxic work environment?
I would have to say leadership. So if the dentist is the captain of the ship, if they kind of let the ship wobble back and forth, it's not really productive. So dentists, quite honestly, have a lot on their plate as well. So we have to give them grace, right? And they have to worry about payroll or insurance and overhead and all those different things. And sometimes they will have an office manager, but the main thing is when there's actual issues going on within the dental team members, that's a problem. So if they kind of give that off to the office manager to deal with, or everyone acts like there's not a problem, then the tension just culminates and builds, and it gets worse and worse. So I would say really that lack of leadership, as well as a big thing, is the appreciation. So most jobs that I have left or gone to another job was because of lack of appreciation. And it's not necessarily saying that the team members need big prizes or huge raises, although a raise would help you keep somebody right now, but it's basically showing appreciation. So a lot of team members just feel unappreciated, and so they will rather go somewhere where they feel appreciated, or at least they're going to get paid more.
Interesting. So what is your advice then to, and I guess we're speaking specifically to dentists because most of the leaders are the dentists in the practice. So what advice would you give to a leader or a dentist of a dental office just to be able to help their team members feel appreciated?
I think what's really helpful if they have either a big team meeting,
Mm.
or if they meet one with the members, or both basically. So they say, hey, this is the challenges that I'm dealing with. So being upfront and open, just like if your personal household is having a budgeting crisis of different things that have happened, if you actually tell the household that, or you have kids and be like, we're not going to have as big of a holiday this year, you're not going to get as many toys or whatever like that, then they may be a little bit more understanding than just not getting anything, and a change of what's been going on for a long time.
Mm.
So just saying, hey, this is the numbers we need to meet in order for you, maybe everyone to be able to get the raise or to get the bonus or to keep your job, just being upfront maybe can help out. And then also maybe one-on-one saying, what do you need? So as a hygienist, what do you need to make you happy, to keep you here? Because I know you're looking, everyone's looking, everyone's trying to act like they're not looking, but everyone's looking or being poached, or the friends are saying, hey, I know you're not happy. This job is paying more. There's a $10,000 sign-on bonus here. So
Mm.
maybe they need to talk to their hygienist who may need instruments. That may all be all that it takes, is brand new instruments instead of using the horrible stuff she's been using, or a chair that's going to help with ergonomics, or maybe being flexible with the schedule. So I was on a coffee chat yesterday with the entrepreneur woman, and we talked about how some jobs, basically, if they would just accommodate some people who need to work 8 to 3 because there's no after school programs, or childcare problems because we're in a pandemic, or if they can job share with someone, that would really alleviate some stress and they'll be able to keep some workers. So just really seeing what the workers need. If
Mm.
the workers feel respected, then they generally stay. So when someone feels valued, they stay. When they don't feel valued, once they get the kahunas, they leave.
I hear you. What about for team members? It's interesting now, speaking from a leadership position as a business owner, as a dental office owner. What about when your entire team needs something different? Each person, which is very likely, we're all unique people. We all
Mhm.
have children of different ages, different hours during the day when we need to be home or not be home, especially because things can happen at the last minute as a parent, as you know, you could go
Right.
through anything at the last minute. So what advice would you give to leaders who have teams who every person needs something different?
Well, I only have one child and I'm new at this, and he's only 4 months old, but I am the oldest of four. And I did help my parents with my siblings because both of them had to work. And so I do know from just hearing and helping out a little bit that what's best is to treat everyone differently. So we can't lump everyone as the same because we all do have different situations. So unfortunately, if you have a team member who has no help and they have a child, maybe make some considerations with that particular team member. If they're late a couple minutes to the huddle, they're doing the best they can. They're doing the best they can. They're not trying to be late to the huddle for a few minutes or whatever, or accommodating different ones. So just really talking to each team member as far as what they need, and if it's reasonable, try to meet it, because that's what's really going to keep them loyal to the practice. I've talked to many different offices and different hygienists who have told me about their office and all the great things they did throughout this pandemic, or even when dentistry was shut down, they kept in contact. They asked if they were okay. Was there anything they needed? They had Zoom meetings. They did CE courses together. Whereas other offices, they just kind of, you fell off the map. You didn't even know, should I file for unemployment? If you get that PPP money, do I get some? Like, what's happening here?
Yeah,
There
no
was no
communication.
communication. So that's the biggest thing. When there's no communication, there's a problem. And I know that a lot of my colleagues, in general, hygienists tend to be people pleasers. So that's why we came into the field. We want to make everyone happy. We want to the patient's teeth to shine. We want the patient to love us. We want good reviews. But the problem with that is sometimes we're fearful of having that communication.
Mm.
So you see it on the forums all day long, where we complain about maybe not having instruments or getting what we need or getting raises, but the doctor doesn't necessarily know that. They don't know these instruments are crummy. They're not using them and everything. So it's communication on both parts. Everyone has to have that communication. So the team members, the office manager, the dentist have to make it known that there's open communication. There's an open door. So, since I'm a parent, I'm going to relate everything to being a parent. So you want your child to be able to come to you with whatever's going on and talk to you about it and not just leave. So a lot of times people just, instead of having that conflicting possible or uncomfortable conversation, they just rather go find another job. And if they had talked to the dentist, maybe some changes could have been made to make them happy.
Absolutely. Just being upfront with it would be amazing. Yeah. What's interesting is you mentioned being able to make accommodations. And one of the things that I think affects a lot of leaders in terms of making those decisions, because I think we all just want to make life easier for everybody in the office, is being fair to all the team members. I've definitely been a part of teams in the past where there's been a feeling that someone's getting preferential treatment.
Right.
She's always getting out at 2 and I have to be here till 5 kind of thing. So what about those kinds of uncomfortable situations where, because you're accommodating each person on the team slightly differently, there's that comparison game?
It definitely is an issue. There's definitely a problem at times for favoritism. I know I've been in that situation. I was actually laid off in 2009. I was one of 5 hygienists, and we shouldn't have had 5 hygienists, but we had a consultant who kept telling them to hire another hygienist. But I was laid off, and before I was laid off, I was really trying to book my schedule, and I was being really productive. But another hygienist, who was the daughter of the office manager, she was on this thing called Facebook all the time. And I was like, I don't know what Facebook is, but I know that they're paying us per patient right now, which was awful, and I need I need patients and everything. So there was a little favoritism there because, of course, she kept her job and I was laid off, even though I helped make a lot of production for the office. And then one of the offices that started me on my platform was a dental assistant who kind of was very close to the doctor. And even though she, in my opinion and other people's opinion, caused a lot of problems with the office, she wasn't really disciplined, or we know nothing was going to happen to her, whereas other people were fired or let go or just quit. So that can be a problem. But I would assume, like I said, I've never been a dentist, but I would assume a good thing would be to sit down with each person. So if I feel a little annoyed that, like, Jennifer's leaving at 2 every day and I'm seeing all these patients, or maybe I'm seeing the harder patients, what do I want? Maybe because I'm a mom, I don't want to come in at 8. I want to come in at 11 and leave at 5, so just seeing what can accommodate me or keep me happy where I feel it's fair. Or maybe I want a longer lunch so I can come home and be with my son for like 2 hours instead of 1 hour, something like that, that's going to keep it fair in everyone's mind. Because like you said, when they seem uneven, it can be a problem. So if I'm being looked at every time, I'll just give myself an example. So this one assistant, the same assistant, she would walk past my room and look to see if I was working, and if I was at my computer or if she caught me on my phone, it's like, oh, she's not doing anything. But she smoked, so she would go and be around the corner at a local drugstore with another assistant smoking and everything like that. So it was kind of like, how are you always checking on me and you're always smoking somewhere? So even among each other, we always are looking for something that doesn't really feel fair.
What's really interesting is that I love this conversation because it allows us to kind of see on the other side of things as well, and the perspective from the other side. And one of the things you mentioned was for the leader, the dentist, to take the time and not just pass it off to the office manager. But often the dentist has zero training, as we know, most of the time.
Yeah.
Most of the time, the dentist has zero training. And especially if there's a gender discrimination, men and women, we don't always know each other's needs, especially as mothers and needs of mothers. And so my question to you is, as you're going through these suggestions, I'm realizing this takes a lot of time in the day.
Yeah.
So to listen to everybody, have a private conversation with everybody on the team, make accommodations uniquely for everybody, and then check in with everybody again afterwards. What do you think that there is room for finding someone who is an expert at this and hiring somebody to specifically do the HR in the practice? Or do you think it has to be the dentist, the leader of the team? I see all the importance of the trickle down effect of leading the way you want your team to behave and the culture and the vision for the practice. But do you think that sometimes leaders maybe should reach out for further support when they don't have those tools to do it effectively?
Yeah, I'm a consultant. So, so yes, they do. And even so I don't always even go into the offices. So I have different ones who contact me, tell me what's going on, and then I give them advice on how to handle the situation. So that
Perfect.
makes it much easier, or, how to be fair. So there was a situation at an office where a hygienist, she made a big mistake. It could have been life-threatening. She actually gave someone some antibiotics before it was a new patient, before the doctor saw the patient. She was just trying to move the day along, and they started to have a reaction. So the owners were very upset concerning that and wanted to fire her. And I talked to the office manager and I said, obviously she made a big mistake. It was life-threatening, but the office doesn't have good protocol with it, because sometimes you give I've worked there, sometimes you give the patient some medicine, sometimes you don't, sometimes so what is the actual protocol? Of course, when it's a new patient, it's really not a good idea, but still. So I encourage them to sit her down, talk to them, but also to have a team member meeting. Everyone sit down and know what the protocol is regarding the situation. So it's not just like, if it's the doctor's friend, we act this way and say, oh, we'll reschedule you. But if it's not the friend, then hey, give them 4 pills and everything, so since it's not consistent, these things happen. So that's one of the things that I do. I do consulting concerning that, because like you said, the doctor doesn't have a lot of time and they have a lot of different things on their plate. It's good to have someone who's kind of off-site and neutral, because the office manager may have favorite people. How they deal with situations. A lot of times they have their favorite people, how they deal with situations. It's not, having a favorite isn't necessarily bad. That favorite may be a very hard worker or someone who's always stepping up to the plate. However, it can cause problems when you're trying to fix different problems, because people see that you have a favorite person.
Absolutely. And especially for team retention, which right now is the problem in most offices.
It's a big problem. So I also have a Facebook group called Dental Hygienist Burnout Prevention, Recovery, Career Options. And so we talk about the different issues that they're dealing with. And sometimes it's, should I stay at this office? Should I leave this office? Or this is how I'm being treated and everything. And that's just like on a lot of different dental hygiene forums. And I'm on dental forums as well. And so it is definitely a big problem at the office regarding retention. And because of this retention problem, some dentists are trying to alleviate that stress and not have hygienists at their office at all. They're either hiring associates or they're trying to do hygiene themselves, which in my opinion is, I don't want to say waste, but I can't think of a better word right now. It's not the best use of their dental skills, in my opinion, because they should be doing other procedures that could be more productive, and allow the hygienist to do that and be able to get patients into their chair. So that's my
Absolutely.
opinion.
So, what do you suggest to your clients? And this is a very big, much bigger question. I'm oversimplifying it in terms of facing this burnout. Now, burnout has been rampant in our profession and really in the healthcare professions at large for
Mhm.
decades. The system really has set ourselves up for it, unfortunately. So, how do you coach your clients in terms of preventing burnout?
So one thing is really evaluating themselves. So that's a big key factor, because sometimes what we can do, and I've done it myself, is that you just flee from a different situation to another situation.
Yeah.
So if you're dating, you may go from one person to another person and everything, but it may be you. So you may have to change some things within you. So like me, I'm constantly working on boundaries, because unfortunately, I let people tread on my boundaries a lot. I try to be nice. I want people to like me. I want to be kind. follow the golden rule, and not everyone does that. And sometimes when people see someone like that, they really try to take advantage of them and bully them. So I talk to my clients about seeing if they have evaluated themselves. Why are you feeling burnt out? What is it? Well, is it just your job? Is things that you need to stand up for? Are you not exercising your boundaries? Are you just feeling overwhelmed because of the work? So some hygienists see way too many patients a day. Have you talked to them about that? Have you maybe considered going to another office that allows you to see less patients or gives you more time per patient? So we really discuss all the different factors that may possibly contributing to their burnout. But to prevent it is really to know themselves. And so that was sort of my problem in a way. Not that I didn't necessarily know myself, but I just needed a job, just wanted a job. And now what really is inspirational to me is the younger generation that comes out. They don't really play that. They want their job to meet all their expectations. They know their self-worth. You're going to pay me all this money. So the other generations, or the hygienists who have a lot of experience, sometimes they get mad at the hygienists that don't have as much experience because they hear they're making more than them. Yeah. But they stuck up for themselves. They knew their self-worth. They know how hard they're working. So they asked for that amount of money. So why are you mad at them? And then they say, I need new instruments. And so the other hygienists will be like, well, I had these ugly instruments for 10 years. Well, did you say anything? Because they came in, they say, I'm not dealing with this. So some of it is us. So developing that confidence, having that ability to communicate and tell people what we want, and to know that if we're not gonna get it, or they can't compromise or meet us somewhere halfway, then we will go somewhere else. We're not just gonna settle. So a big thing is making sure they're not just settling in their work life or just their life at all.
Yeah, and then once again comes in that very critical aspect of communication. Being able to understand yourself and what you need, and then being able to communicate it proactively with your boss. What we need right now is to leverage happiness in the workplace. If you're a leader or manager struggling with retaining team members and frustrated with the current staffing shortage, group coaching for your team is your solution. Christina Unrein and I have partnered together to build a 10-week group coaching workshop for your business, focused directly on increasing happiness and positivity in the workplace. How do we do this? We use the awesome systems you already have in place and support your team members directly with tools for a mindset shift for awareness of their individual power to own their own happiness. Learn how to cultivate accountability for happiness in your team members and guide them with the tools to own their empowerment at work. Turning around workplace culture starts with individuals, and Christina and I are here for you. Email me at taryn@thebizofhappiness.com if you are ready to make workplace happiness your competitive advantage. Yeah.
And it can be terrifying. I mean, I used to the fight or flight response, my heart would be beating in my chest and everything. And I mean, tell me you're going to talk to me later. I am like, what did I do? I never do anything, but I'm like, what did I do? I'm just sitting there thinking, I'm afraid. It's like you're telling me I'm going to the principal office. Like, I'm such a goody two shoes. So, basically it's developing that strength, that inner core strength that we all need. So that's what I really help my clients to really kind of stand up for themselves. And I recommend that they document their day. So they should go about documenting everything that happened, just like we document notes. Try not to have emotions in it. And I really find that helps, because they can really go back over time and see exactly what happened. So if issues have been happening at the office that are toxic, and then when you go tell someone, they say, oh, you're just being too sensitive, or, that didn't really happen, because gaslighting can happen as well. That's a part of toxic work environment. They act like you're going crazy, they make you crazy. Then they can really go back and see, no, this is exactly what happened. So it's kind of like if you're doing your notes and you've told a patient they need a certain type of procedure, And then they need to come every 3 months to maintain that procedure. And then when, after the second visit, they're like, no, you never told me this, or I didn't know I had to pay this. And you're like, oh, look like the signature right here. It's right here.
Yeah.
So when you bring documentation, not to say you're going to ever have to go to court with it, but at least you're looking at it like, oh, I'm not crazy because this is what happened on this date. So that's what I encourage, some of the things I encourage to do.
Very cool. I love that idea of documentation, just to remind yourself you're not going crazy, because I think it's true. So many of us do just question ourselves and our self-worth. And sometimes we think, well, maybe I was doing something wrong in that moment. How do you handle this? Because I know you speak to teams as well. So when you're coaching a whole team, this is such great information for individuals. How do you do it in a team setting?
Well, first you need to actually talk to the leaders and see what they're going through, and then break it down, talk to everyone individually, and then come together. That's the best way to go about it, because the hygienists and the team members, they'll tell me everything. So even like with friends, I'll be like, so I heard that this person left, and she's like, how did you? I'm like, everyone tells me everything, babe, and everything. So it's best to break it down that way separately, and then kind of like a family meeting, even though I don't like to say, I hate when they say this is a family. Oh, I hate that. But basically you break it down where you talk to leaders, and then you talk to the team members, and you bring them all together, and you try to have everyone work on this problem or see how they can come together in unison.
I love that. Why does that trigger you so much to call it a family? That's fascinating. Because many, many dental offices do that. They say, this is our family.
We hate that. They need to stop. That's like saying we need a hygienist rock star. It's so annoying. Because you shouldn't do it. It's a lot. If you put that on an advertisement, more than half of the hygienists won't apply just because you said that, because that triggers us, because it makes us think like, oh, you want us to do everything. So saying that we're a family, like, are we a close family? Are we dysfunctional family? What type of family are we? And everything. So I've only worked at one office. It was the unicorn office I talk about in my book. I cannot get into that office because no one leaves. That they actually are a family. They actually have pictures on the wall of their family. So I would have a picture of my husband and my son, and you would have a picture of your family. Everyone would have a portrait that was taken on the wall, so patients could see that. They treat one another a certain way. I worked there as an assistant, but everyone's been there forever. So a lot of offices that say that, for the most part, they're not really family oriented. Not all of them. Some offices are very family oriented, but some who say that we treat each other like a family, it's like a family that needs to call DCF. It's not good.
Well, interesting, because there's a little bit of gaslighting in there too, I guess, like, yes. No, this is a family, but it doesn't feel like a family. It doesn't feel like you're being taken care of as a family should.
Yeah, that's so that always I put memes about that all the time in my groups or on LinkedIn. I'm like, I joke about it. Or that my other thing is the pizza. So every time there's a big problem in the office, or people getting ready to fight or getting ready to quit, it's time for a pizza party.
Oh, really?
And it's not even a good time, and it's like, sometimes you don't even get the pizza because you're working doing lunch doing a deep cleaning. So it's
when the pizza comes out, there's a problem happening. Oh,
Julie,
man. Oh, that's fascinating.
Julie, like, it's like, what if I'm trying to be vegan this week? Like, can I get a salad? So but it's true. Everyone, we laugh about it, and that gets so many likes and responses because everyone knows it's true. When things are really going bad, in fact, I probably post something about it next week. When things are really going bad, instead of yeah, they throw a pizza at it instead of actually sitting down and talking about it and everything. Everyone gets pizza, and it's not even the expensive kind; it's the cheap kind. Everything.
So what about those offices, Kari? And I can think of so many that are really trying. They're really trying, and they're not buying the pizza. And they're having the tough conversation, and they're listening to Brené Brown's advice and rumbling with these uncomfortable conversations, really trying to understand each team member's specific needs. And still there seems to be within the team some drama, which happens so often in dental offices, which makes or leads to people leaving the office. What advice do you have for those offices?
They just have to keep doing the work. I mean, there's no there's no guarantee that people are going to say. Sometimes people who leave need to leave. And the thing is when they leave, don't treat them horrible. So sometimes a hygienist will give notice and then they're not talked to, or there's tension, or people start talking behind their back. Someone is mad, especially the doctor, because now they have to go find somebody and everything. So, be nice about it, and maybe leave the door open. If they were a great employee, okay, we really appreciated you. Thank you for treating our patients with respect, blah, blah, blah. And then they will at least stay. Sometimes in these situations, they're shown the door that same day. Because I always tell people, before you get that notice, make sure you have all your personal effects, because you never know what's going to happen. I've been shown the door between that week, or it just starts getting very awkward and tense, and you don't want that to be in that mental space. But offices that are really trying, but unfortunately, they're still losing people. It's just a very hard time right now.
Yeah.
It's a hard time for everybody. And the fact of the matter is people will go where the money is. That's not always a good situation. I mean, we all want to be paid as much as we can be paid, but sometimes we do have to see if it's a positive work culture. I have taken pay cuts. If you're supportive of me, if it's not a problem when I need to leave and go on vacation, if you just support me and value me and appreciate me and everything and make me feel good and warm and fuzzy inside, then maybe I'll take a pay cut, as opposed to offices that I've worked at where I've made a lot of money. However, you almost sent me on a nervous breakdown. So it's not always about the money. But right now, offices should, maybe if they can, try to either give raises, in my opinion, or give something. You're going to have to give something, because everyone's talking about, we all know the shortage. So everyone's looking everywhere and seeing if they can jump ship. I was just told a big DSO, they gave retention bonuses. So they were doing hiring bonuses, really big hiring bonuses. And so their hygienists were mad, who have been there for years, that people could get almost like 10 grand. Like, okay, well, let me go somewhere else and get 10 grand then, because I've been here forever, and you stopped giving raises years ago. And because we get bonuses. So they had to give retention bonuses because people were leaving, and then they had to give money across the board. So a pretty good amount that would make everyone stay across the board. So we just have to be proactive and care for one another. And I think, like we keep talking about, having an open line of communication with what's going on is really going to help people. So just being quiet about everything, or just acting like these things aren't going on, isn't gonna help.
Yeah. You mentioned one other thing is that positive work environment. We talked about the toxic work environment, but the really positive work environment. And so what in your mind is a positive work environment beyond the leader having these difficult conversations, being very proactive about being aware of all the team members' needs? What else constitutes a positive work environment?
I would say that everyone is respectful of one another. So even though we all have different personality differences, or maybe lifestyles and things, that we respect one another, and that we try to help one another. So a lot of times there's divisions in offices, front office, back office, they can be backbiting or complaining with what's going on, but having the communication. So being on one accord, everyone knowing the different protocols. So if a patient comes in late, if the rule is that the patient can't go back after 15 minutes, don't just go put a patient in the hygienist chair or the doctor's chair, because then they're going to be stressed out, because you can't really get the patient out afterwards, because that's just rude. But you can say, hey, we have to reschedule you, unfortunately, or we can only take x-rays and do the examination. So just being respectful of everyone's time. Making sure everyone can get a break, some type of break. A number of professionals complain about they don't get lunch, or they can't go to the restroom or take care of their necessary bodily needs. So that's not good. So making sure everyone gets a break, feels respected, helping out one another. So if I'm a hygienist and I don't have a patient and I've done all my responsibilities, can I go and see what is happening with the assistants, if they need help, if they need sterilization help or x-rays taken or their room clean, or help out at the front? But at the same time, can it be done to me? So if someone at the front doesn't have anything to do, can they maybe seat a patient in a room for me, or help flip a room, everyone just helping one another. So it's even when some dentists have helped me, that really elevated them in my eyes, because some don't and everything like that. So it's nice even when they done that, or they respected me or asked me my opinion concerning a case, or respected me as a provider. So just having that multi-level respect all the way around can really help with a positive work environment. So it's not just like, hey guys, let's go on the weekend and go do some work activity. No, it's more like how you take care of one another all throughout the day. And the reason I guess that does trigger me with the whole we're like a family situation is, quite honestly, we see one another at work more than we see our families for the most time, if you're working full time. So you would want it to be positive and be helpful towards one another, so that you're not sitting in your car like before work, like to the last second and everything, or as soon as it's time to go, running out the door. So it really fosters good work culture when each one can help one, basically.
Absolutely. So what is your definition then, Kari, of happiness for yourself?
Me, happiness for myself right now would be sleep. Because
I mean, that is not a small thing. And I think that's so important. I know you have a little one who's 4 months old and you're missing sleep right now, but I think even beyond that, we don't give ourselves enough credit for how important taking care of ourselves before we get to work actually is. If you aren't able to get sleep, and of course you get so much love right now as a fellow mama, and respect in that regard, but taking the responsibility for finding ways to refuel and replenish yourself before you get to work, so you can be that best team member.
So what I used to do, especially when I was in different situations, work situations, where I was in a toxic work situation, what I did daily, and I talk about this in my book, is that I would exercise early in the morning. So I was an early riser before the baby. So I was an early riser. I would be up at like 5. You didn't
know the definition of early rise before you had a baby.
Yeah, now I work from home now. So now I did one lunch and learn for office. They needed an early morning. And I'm like, that's never happening again, because I can't see you at 8:00, But before, what I would do is I would exercise really early in the morning. And when I was exercising, I would listen to motivational videos on YouTube. So like Les Brown, Eric Thomas, hip hop preacher, Tony Robbins, all these different motivational speakers. I would listen to that. And then I would have like my smoothie. I had a whole thing to keep me healthy, so that I could keep my brain healthy, because I knew when I get to work, maybe I would have to deal with this individual who was just horrible. Yeah. But if I had done all these different things, not only did I look great and I felt great, then mentally I could deal with that situation, that scenario. So that's one thing that really worked for me during that time, was to make sure that I was exercising. And that's one thing that I talk about in my course, is exercising, journaling, listening to positive things, affirmations, motivational videos, basically feeding yourself positivity. Yeah. Because if you're feeding yourself negativity all day long, I hate my job, I hate my job, I hate my job, I hate her, I hate her, then you're going to be overwhelmed with this sadness or resentfulness.
It becomes your reality.
So kind of like, I back in the day, I didn't really like the Secret. I used to think it was like woo-ah, and I'm not into that stuff. But I've learned that although I don't really still ascribe to that, when you really kind of manifest happy things, good things happen. So when you constantly think of like, I'm going to get fired, I did get fired, because you kept thinking about it. It's almost like a self-fulfilling prophecy, because maybe you're not working as hard as before you had that thought that you think this was going to happen. But when you start really being positive and thinking like, okay, maybe this situation isn't working right now, but it's not going to be like this forever, then something happens and a good opportunity happens, or someone speaks your name in a room you know nothing about, and another opportunity happens, or you get this job from a friend or something like that. So really taking care of yourself daily can bring about that happiness. So even this week, I started, I got a jogger stroller. So I started my Couch to 5K program again. I had tried about a month ago, but I started again, and I started eating smoothies. That's why I went to Trader Joe's this morning. I bought some more fruits and vegetables. And, if I'm going to have some chocolate, like, let me eat a dark chocolate with some sunflower or something in it, make it feel good.
Yeah.
So doing all these different things can make you feel happier, and not just focusing on how maybe you feel burnout. So that's why in my Facebook group, I don't just always put something about burnout or have funny memes or something funny to make you laugh about the situation. And then I also talk about recovering, because if you're just always complaining about the burnout, what are you doing about the recovery?
Yep.
Because you're going to stay there. It's kind of like Les Brown says, what's he say? If you can fall down, try to land on your back so you can see the way up, and something like that. He does it better. But basically, you don't want to just stay burnt out. You want to work towards the recovery or see what's going to help you out of that situation.
Build up your strength again. Yeah. And realign with the power that you have to find a happy solution, find a happy life beyond this. Yeah. I love that. I love that, Kari. Thank you. So, Kari, what do you think? What is your superpower?
My big mouth. Talking. I love talking. I could do it all day. So it was great when I decided to become a public speaker.
Yeah.
So I really love talking to people, having conversations, especially with people, giving my course to help one another. That's one reason actually why I became a dental hygienist. My mom suggested it. And so I laugh because when I have a captive audience. So most people want to hear my stories or my latest travel trips and the stuff that I did, or if I was working, they'd want to hear about the baby and stuff like that. So just talking and being able to relate to people. I've lived in 7 states, and I kind of, for the most part, can relate to different people of different backgrounds. So I think that's my superpower. And being that I try to be diplomatic. So inside I may be mad at someone, but I never really show it, unless it's my husband. But everyone else. But I would say speaking is my superpower. And I've been doing that my whole life. And the funny thing is I have passed that trait on to my son. So that will be my I think the word is, because he talks. Like, he's only 4 months. He said his first word when he was 2 months, which was hungy, which meant hungry.
My gosh.
And yes. I swear he says help, because I have him still swaddled in his special little bassinet, and when he's ready to get out, he starts fighting and goes, help. I was like, did he say help? So when he's on different, he tries to speak. If I've had him here, I hear him upstairs and he's just talking. So that's what I like to do. I like to talk to people. I love to communicate. I love writing. Those are my basically communication.
So cool. You do it beautifully.
Thank you.
If you were to leave us after this, and thank you for this beautiful interview. Thank you for your perspective. I do have to start with that. I really do appreciate it, because I think that this communicating is so critical for us to be able to open our eyes to see what we need from each other, so that we can create that team environment and that positive workplace environment. So thank you for sharing your truths with us.
You're welcome.
And before I ask you this final question, how can my audience find you? You've just mentioned some amazing opportunities in terms of your book, courses, the way that you coach dental offices. And please tell us how to find you.
My email address is cherelussmiles@gmail.com. I have a link, is bit.ly burnout dental hygienist. On Instagram is KMC Smiles. On Facebook is my name, Kari Carter-Cherelus. I have the Facebook group, Dental Hygienist Burnout, Prevention, Recover, Career Options. So I'm all over social media, and I'm on my phone all day long.
Fabulous.
Working on that, but I like technology. I like my phone.
We'll put all those links in the show notes. So if any of our audience members want to find you, please check out the show notes, and definitely leave Kari some love on her social media accounts. And please, before we leave, my last question to you, Kari, is, could you leave us with just one statement of impact of how we can help ourselves to avoid burnout?
How can you help yourself to avoid burnout? I would say to be true to yourself. So if you are true to yourself, if you acknowledge your self-worth, If you set boundaries, then these are different things that will help prevent you from burning out. However, if you do none of these things, then you will burn out very quickly. So my father, he's a fire protection engineer. My husband's a firefighter. And so it's funny that I talk about burnout because it's, but you don't want to burn out like a candle. So you want to keep that flame basically always going. And you are the key to that. So you can leave any situation that is harmful or abusive, but you have to build up yourself to make yourself leave, or at least stand up for yourself.
There you go. Thank you so much for all that you do, Kari. I appreciate
You're
you.
welcome. Welcome.
And thank you to all of you for joining us on this episode. I know that you got as much incredible advice here from Kari as I did. And notice I used the word fire there to throw in that candle spark, and just remember to always take care of yourself. And as always, remember, when you feel good, that's when you can do good. Bye-bye.
Hey guys.